Ah, the pharmaceutical industry, those benevolent angels in lab coats, selflessly toiling away to cure our ills. Or are they? Because when you look at the mountains of cash involved, it starts to feel less like a life-saving operation and more like a life-sucking enterprise. We're talking billions upon billions of dollars swirling around a system that seems increasingly designed to keep us hooked on pills, injections, and treatments, rather than actually making us healthier. And let's be clear, this isn't about demonizing every scientist or doctor. This is about asking the tough questions about the system itself. Because when corporations whisper sweet nothings about patient outcomes while their CEOs are buying their third yacht with money made from your chronic back pain, something stinks worse than a week-old bottle of amoxicillin. So buckle up, Buttercup, because today, we're diving headfirst into the murky, often morally bankrupt waters of Big Pharma and asking, are we actually patients to them or just walking, talking profit centers? Now let's rewind the clock back to the 1990s. Remember the 90s? The Spice Girls, the Backstreet Boys, and a little thing called the opioid epidemic, kicking off its reign of terror. See, pharmaceutical companies, led by the charming folks at Purdue Pharma, were pushing a magical new painkiller called OxyContin, and how did they convince doctors to prescribe this highly addictive drug like it was candy? By aggressively downplaying the risks, of course. Sales reps fanned out across the country, armed with misleading information and the promise of lucrative speaking fees for doctors who hopped on the OxyContin train. Internal documents later revealed that Purdue Pharma knew damn well how addictive OxyContin was. They knew people were crushing and snorting it to get high. They knew lives were being ruined. Did they care? Well, let's just say their concern was more focused on counting their mountains of cash than on the mounting body count. This wasn't just a tragic oversight, folks. This was a calculated business decision. They saw an opportunity to exploit human suffering for profit, and they went for it with the subtlety of a runaway dump truck full of cash. Now let's talk about cancer. That's right, the big C, the emperor of all maladies. A word so terrifying, it can silence a room faster than a vegan at a BBQ. We pour billions of dollars into cancer research every year, yet a true cure remains elusive. Or does it? Because lurking in the shadowy corners of the internet, whispered about in hushed tones, is the idea that Big Pharma is suppressing cures for cancer. Why? Well, the theory goes, a cure would be bad for business. After all, they make more money treating a chronic condition than they would from a one-time cure, right? It sounds crazy, like something a conspiracy theorist in a tinfoil hat would scream about, but is it entirely outside the realm of possibility? Let's just say, when you consider the track record we've already established, it's enough to make you want to swap your chemo for a tinfoil hat and see which one makes you feel less crazy. Now let's go back to the 1970s, a time of bell-bottoms, disco fever, and a controversial cancer treatment called Latril, derived from apricot seeds. Now, Latril was never proven to be effective in clinical trials. In fact, the FDA called it quackery and banned it. But despite the lack of scientific evidence, some patients swore by it. They claimed it shrank their tumors, alleviated their pain, and gave them hope. So was Latril a miracle cure that was suppressed by Big Pharma? Or was it a dangerous placebo that gave false hope to desperate patients? The truth, as always, is likely somewhere in between. But the Latril saga highlights a fundamental tension in the world of medicine, the tension between established science and anecdotal evidence. Now, Big Pharma will be quick to point out that developing new drugs is incredibly expensive and time-consuming. And they're not wrong, but it's also incredibly profitable. We're talking billions of dollars in profits for some of these cancer drugs, often for treatments that extend life by a matter of months, not years. So while they claim to be motivated by a desire to alleviate human suffering, it's hard to ignore the massive financial incentives at play. And when you consider that many of these companies spend more on marketing than they do on research and development, it starts to feel a bit icky, doesn't it? It's like that friend who talks a big game about wanting to save the world but then spends all their money on avocado toast and designer coffee. So, are there miracle cures for cancer being suppressed by Big Pharma? Probably not. But is the profit motive influencing the direction of cancer research? Absolutely. And until we address the fundamental problems with the way we fund and incentivize medical research, the search for a cure will continue to be clouded by suspicion and mistrust. But don't worry, it gets worse. Because in our next chapter, we'll be diving into the wonderful world of vaccines, where the stakes are even higher, the conspiracy theories even wilder, and the truth, as always, is somewhere in between. Vaccines. They're the medical miracles we rely on to keep horrific diseases like polio and measles from turning our children into, well, historical footnotes. We pump our kids full of them, hoping for immunity, not realizing the irony of that word when it comes to big pharma. Because in the shadowy backrooms of this multi-billion-dollar industry, there's a conversation they don't want you to hear. A conversation about profit margins and liability shields, about the very real risks versus the often exaggerated rewards. See, in 1986 something extraordinary happened. Ronald Reagan, a man not exactly known for his socialist tendencies, signed a law granting vaccine manufacturers something close to legal immunity. That's right, folks. You can sue a clown for slipping on a banana peel at your kid's birthday party, but if your child has a severe adverse reaction to a vaccine, good luck finding a lawyer who will touch that case with a 10-foot pole. Now, before you grab your pitchforks and join the nearest anti-vaxxer rally, let's be clear. Vaccines have saved countless lives. They are one of the greatest public health achievements in human history, but, and this is a big but, the 1986 National Childhood Vaccine Injury Act wasn't just about protecting public health, it was also about protecting Big Pharma's bottom line. The official line was that lawsuits were threatening vaccine production, creating a vaccine crisis. And sure, there were lawsuits. Some legitimate, some, well, let's just say some people blame vaccines for their irritable bowel syndrome. But instead of reforming the litigation process, Congress went nuclear, creating a special court, the National Vaccine Injury Compensation Program, to handle vaccine injury claims. This court, my friends, is about as plaintiff-friendly as a shark tank filled with hungry lawyers who just happen to be on Big Pharma's payroll. Okay, maybe not literally on the payroll, but let's just say they're very well acquainted. Like, let's go on each other's yachts and laugh about the little guy acquainted. So, what's the problem with this cozy arrangement? Well, for starters, it creates a system where vaccine manufacturers have little incentive to prioritize safety. After all, if something goes wrong, they're not the ones footing the bill. Secondly, it fuels public distrust. When you tell people they can't sue a company, even if that company's product harms them, they tend to get a little, shall we say, suspicious. And finally, it raises a fundamental question. If vaccines are as safe as Big Pharma claims, why the need for legal immunity? It's like saying, trust me, this car is perfectly safe, but just in case it explodes, you can't sue me. Look, I'm not saying vaccines are bad, I'm saying the system surrounding them is about as transparent as a bottle of Pepto-Bismol. We need more transparency, more accountability, and less legal maneuvering that benefits corporations over individuals. The truth, as always, is probably somewhere in the middle. Vaccines are vital, but the industry that produces them isn't exactly known for its altruism. And when it comes to your health, well, you deserve to know the whole story, even if it's buried under layers of legal jargon and corporate spin. So, the next time you roll up your sleeve for a shot, remember this. You're not just getting a vaccine, you're getting a dose of a system that's rigged in favor of Big Pharma, and that, my friends, should give us all pause. Health insurance. It's that magical system where you pay exorbitant fees every month for maybe, possibly getting some of your medical bills covered. Emphasis on maybe. Because if there's one thing insurance companies love more than profits, it's denying claims. They'll cite pre-existing conditions you didn't even know you had, or claim a treatment is experimental, even if it's been standard practice since your doctor was in medical school. And let's be clear, experimental is insurance speak, for we don't want to pay for that. It's enough to make you wonder, are these insurance companies actually in the business of healthcare? Or are they just highly profitable casinos, gambling with our lives instead of chips? Because let's face it, when a CEO like United Health's David Wichmann is raking in $18 million a year, while patients are denied life-saving treatments, something is rotten in the state of American healthcare. Let's talk about pre-existing conditions, shall we? That magical phrase that strikes fear into the heart of every American seeking health insurance. You see, to insurance companies, a pre-existing condition is anything from asthma to stubbing your toe once in 2003. They use it as a catch-all excuse to jack up your premiums, or better yet, deny you coverage altogether. It's like being punished for having the audacity to, have a body that occasionally malfunctions. Imagine this, you walk into a car dealership, excited to buy your dream car. But before you can even buckle up, the salesman takes one look at you and says, sorry, we can't insure you. You have a pre-existing condition, you've driven other cars before, it's absurd, right? Yet that's the reality millions of Americans face every day. Now let's delve into the murky waters of experimental treatments. According to insurance companies, nearly every medical advancement since the invention of the Band-Aid falls under this dubious category. They'll tell you a treatment is too new, too unproven, too risky. But here's a newsflash. Sometimes those risky treatments are the only options left. And often, the biggest risk isn't to the patient's health, but to the insurance company's bottom line. It's a bit like going to a mechanic when your car breaks down, only to be told, sorry, we only fix things that were broken in the 1998 Honda Civic Owner's Manual. Anything else is too experimental. You'd be outraged, wouldn't you? Well, welcome to the American healthcare system, where your life is treated like a used car with a limited warranty. So what's the solution to this healthcare hellscape? Well, it's complicated, but one thing's for sure, something needs to change. We can't keep letting insurance companies prioritize profits over people. We need transparency, accountability, and a system that puts patients before shareholders. Because healthcare shouldn't be a privilege, it should be a right, and no one should have to choose between their health and their financial well-being. The United States, land of the free, home of the brave, and proud owner of the most expensive healthcare system in the world. We're spending a whopping $4 trillion a year on healthcare. That's more than any other nation on Earth. You'd think with that kind of investment we'd be living longer, healthier lives, right? Well, buckle up, because here's the kicker. We rank dead last in life expectancy among wealthy countries. That's right, folks. We're pouring trillions into a system that's failing to deliver. It's like ordering a 5-star meal and getting a stale cracker. So, what gives? Why are we spending so much for such dismal results? The answer, my friends, is that we don't have a healthcare system. We have a sick care system. Think about it. Our system is designed to treat us when we're already sick, not to prevent us from getting sick in the first place. We're like firefighters who only show up after the entire building has burned down. Sure, we're great at treating heart attacks, but what about promoting healthy lifestyles to prevent them in the first place? We're experts at managing diabetes. But what about addressing the root causes like poor diet and lack of exercise? It's like putting a band-aid on a bullet wound. We're treating the symptoms, not the cause. And as any doctor will tell you, prevention is always better than cure. And let's not forget the elephant in the waiting room, profit. The sick care system is incredibly profitable for some. Pharmaceutical companies make billions selling us drugs to manage chronic conditions. Hospitals rake in profits from expensive procedures and treatments. And insurance companies, well, we've already covered their racket. Don't get me wrong, there are countless dedicated healthcare professionals working tirelessly to care for patients. But the system itself is designed to prioritize profit over prevention. It's a system that thrives on sickness, not health. So what can we do? First, we need to acknowledge that we have a problem. We can't keep throwing money at a broken system and expect different results. We need to shift our focus from sick care to health care. That means investing in preventative care, promoting healthy lifestyles, and addressing the social determinants of health like poverty and access to nutritious food. It won't be easy, but it's time to stop treating healthcare like a privilege and start treating it like a human right. Look, I'm not saying every doctor is in cahoots with Big Pharma or that every insurance claim denial is a conspiracy, but these stories do raise some uncomfortable questions about the state of our healthcare system. Should profit ever come before patient well-being? Should corporations have the power to dictate who gets treatment and who doesn't? These are questions we all need to be asking. Change starts with awareness. So, stay curious, fact-check everything, and demand transparency from those in power, because when it comes to our health, we deserve nothing less. If this video opened your eyes, even just a little, then please, smash that like button, subscribe to the channel, and hit the bell so you don't miss out on future investigations. And be sure to share your thoughts, your suspicions, your wildest theories in the comments below. Until next time, stay skeptical.